City and state officials provided an update on the swine flu situation in the Chicago area at an April 29th news conference. Here are highlights from that briefing on Chicago Works.
Good afternoon. Like any situation in Chicago, the Office of Emergency Management and Communication has been coordinating across departments and with regions and across the state to help us be prepared as any big city can be. And Mayor Daley has called us here today to ensure that the city continues working together across departments to address the need for resources should they arise. Along with our mayor, we are honored to have Governor Pat Quinn with us today for this briefing, as well as Dr. Damon Arnold, Director of the Illinois Department of Public Health, Andrew Velasquez, Director, Illinois Emergency Management Association, Dr. Terry Mason, Commissioner, Chicago Department of Public Health, Ron Huberman, Chief Executive Officer, Chicago Public Schools, Michael Boland, First Deputy Commissioner, Department of Aviation, John Brooks, Commissioner, Chicago Fire Department, Mary Ellen Karen, Commissioner, Family and Support Services, Philip Hampton, Director, 311 City Services, James Jackson, Assistant Superintendent, Chicago Police Department. We also have Dr. James Galloway, Assistant U.S. Surgeon General, and Dr. Stephen Martin, Director, Cook County Department of Public Health. And we also have other health representatives represented from municipalities throughout the region. At this time, I would like to turn it over to Governor Pat Quinn. Governor.
Okay, thank you. Yes, sir. Well, it is an honor to be here. This is a very special place to our state and indeed to our whole country. It's the best of the best, and we honor all the men and women who work here on behalf of the public safety, the public interest. And it is very important that we work together in Illinois at all times. And I look forward to working with Mayor Daley on this particular challenge. All of those who are gathered here today understand that we have to work as a team. We believe in teamwork. In the state of Illinois, we have a Department of Public Health headed by Dr. Damon Arnold, and we have an Illinois Emergency Management Agency headed by Andrew Velasquez, both of whom are with us today, and they will both be speaking. But we have found in our state that teamwork is the key in any kind of situation, emergency, whatever the case might be. It's important that we work together. We are well trained. I think that is a very important part of dealing with any new challenge, that we have training ahead of time that has allowed us to proceed during any kind of emergency. I do want to point out that yesterday I signed a proclamation, a gubernatorial proclamation, pursuant to our Illinois law that makes sure that everything we have at our disposal is available. We have the Illinois Department of Transportation, the Illinois Department of Corrections, the Illinois State Police, the Illinois Department of Public Health, and the Emergency Management Agency, and other agencies as well, and they are coordinating their response to this particular public health challenge. We do have a very close contact with our federal government counterparts. We want to thank the federal government for its very quick response. Medicines are being sent to our state of Illinois. They will be disseminated to local health departments and hospitals across the state in case they're needed. And we have a plan that has been worked on over and over again with training by very well-trained individuals that will allow us to deliver all the medicines in a quick way. I think it is important that we work with local governments, local health departments, hospitals, so we're prepared for any possible emergency. I think basic public health measures are what all of us as citizens need to take to heart. We will hear from Dr. Arnold and other doctors today about common sense things that all of us should do not only today, but every day with respect to our public health and sanitary measures. I do want to say, on behalf of the people of Illinois, almost 13 million people, we are a family. When a family has a challenge, we come together. We are a group of individuals in Illinois, almost 13 million strong, who understand that the fundamental values of working together are what really helps us at a tough time. The people of Mexico, we understand that you're going through a very difficult period, and we are with you. And for all of those in the Mexican-American community of Illinois, the family of Illinois, we want to be with those families in particular. So all of us are in this together, everybody in, nobody left out, and together we're going to get through this challenge and every other challenge. Thank you.
I personally want to thank Governor Pat Quinn for his leadership that he's provided statewide in working from the Illinois Department of Health, Illinois Emergency, with all the local officials, not only the city of Chicago, but throughout the state, both in the city and townships and counties. The governor understands how important cooperation is, and we want to thank him for his leadership, as well as working with the federal, state, and local governments. This is a team effort. We are all here assembled here, and I want to thank the governor for the leadership and his commitment of working with all of us in regards to the swine flu and how it's affecting not only our city, our state, and our nation. This is a serious challenge which must be addressed very responsibly and professionally, especially with the medical profession and research people, both in city, in the county, in the state, in the federal government, yes, in the private sector and non-for-profit. So no one needs to panic on the issue. Along with all the other government agencies, the growing challenge in the last few weeks is reviewing our plans to ensure that we fully anticipated, which we have. As you know, late yesterday, the Chicago Department of Public Health became aware of a probable case of swine flu in a child who attends the Kilmer School on the north side. City officials promptly notified their counterparts, of course, of federal, state, and local agencies, especially Illinois Department of Health, counterparts at Chicago Public Schools, who investigated and have decided to close the school temporarily. Let me stress that this is a preventive step, prevention, that's designed to help break the cycle of a disease transmission and protect everyone at the school, as well as a larger community. At the moment, there are no other known cases of swine flu at the Kilmer School, but as public health authorities, these are professional people, have said repeatedly, the swine flu situation is fluid and changes from day to day, and that's what we have to understand. The CEO, Ron Huberman, will report in a moment. They are following this challenge very closely in each and every school here in the city of Chicago. As we move forward, we must continue to act very wisely, responsibly, and I think everybody is. I want to assure Chicagoans that the city government is on top of the situation. Before I review a few of the things we're going to protect the people of Chicago, I want to step back for a moment. As swine flu has spread across the United States and around the world, we have said publicly that we anticipate seeing cases in Chicago across the surrounding area. So yesterday's announcement of a case in northern Indiana and today's announcement of a case in the city of Chicago are not a surprise. People need to be concerned about and watch out for their family members. As always, when it comes to widespread illnesses, we are the most concerned about the very young and the old and those who are already confronting other serious health concerns. That's why all city departments are taking steps to address this concern collectively. To coordinate a response to the swine flu situation, we're activating the Joint Operations Center led by the Office of Emergency Management and Communication, including fire, police, aviation, and health departments. The 311 Center, the Chicago Public Schools, and Department of Family and Supportive Services. We encourage families to visit our website at alertchicago.org to receive emergency preparedness tips. While you are at the website, you can also sign up to receive Notify Chicago alerts. We have been proactively sending facts about the swine flu using this paging system. It is a great free resource that residents should use. Our health department has created a special swine flu website where residents can get comprehensive information about the disease. The website includes, among other things, a swine flu fact sheet in English, Spanish, Polish, Chinese, Korean, Arabic, Vietnamese, Burmese, as well as Russian. The Chicago Public Schools has launched an internal notification process to all schools and faculty about what to expect and what students and parents should do. In addition, the school system has sent letters to parents and guardians in both Spanish and Polish and English about the situation and safeguards that should be taken. And the Department of Aviation is working very closely with city and federal agencies and the airlines to raise the traveler awareness about the swine flu. DOA, Department of Aviation, is posting signs at key arrival and departure areas at the airport with information on flu symptoms, preventive measures to be taken to prevent the spread of illness. Our city departments heads can give you more detail about what we are doing, but let me just say again, All of us are well prepared as we can be for the flu. The best thing we could all do is stay alert, be aware, and of course safeguard all of our children and our families. Thank you very much. At this time, I'd like to introduce Dr. Damon Arnold, Director of the Illinois Department of Public Health, who's been a great resource, not only Chicago, but the entire state. Thank you.
Thank you, Mayor. I'm going to start off with giving you a bit of a rundown on the history of how this disease progressed. We started, of course, in Mexico. It has involved multiple states in the United States. At the present time, I'm here to deliver to you some of the results of our laboratory testing. Before that, I do that, I'm going to give you a little bit of a rundown on how the lab testing is done. In short, basically, a person goes to a clinical setting. They see a provider. The person presents with symptoms. They can present with a fever, sore throat, cough. Those are the ones that we sort of key in on right now. They also can have body aches and pains. They can have chills. They can have nausea and vomiting, which are much less common. Once that swab is done, an initial test is done as a screening test. It is not definitive. However, many practitioners will start placing people on medications if they feel strongly enough clinically that this is indicated. That test swab will then be sent to the Illinois Department of Public Health laboratory system, where it will go through two tests. The initial test is to determine whether you have influenza A. If you do, after the 4-hour test period, another 3-hour test is run with the kit that is supplied by the CDC to our laboratory system. That will then give you a diagnosis, presumptive, of whether you have a positive test or not. It is called a probable result. That probable result is 99% sure that you probably have swine flu. That test swab is then sent to the CDC for definitive testing, and in 24 to 48 hours, that test will come back either as being positive or negative. As I said, 99% is a hard number to beat. That test then will be recorded by the CDC in their registry. Once you have that diagnosis, all along the course between the clinical setting, the laboratory here within the Illinois Department of Public Health, and the CDC, that person is receiving continuous care. Within the city of Chicago, for example, they have already done contact tracing, and Dr. Mason will talk about that more. What I'm here to tell you about is 9 probable cases. These 9 probable cases, 5 are within the city of Chicago, 2 are within Kane County, 1 is in DuPage County, and 1 is in Lake County. The ages are ranging from 2 years old up to 57. We have more specific information, if you would like, during your question and answer period about specifics on that. What I want you to understand is that with the proclamation that the governor has signed, he has allowed a system that has been in place for years. We have been working on the pandemic flu issue for multiple years. This has been going on with multiple groups, community-based organizations, faith-based organizations. We have made sure that people were being trained. We've had town hall meetings on this issue about pandemic. It was the foresight of people like Governor Quinn and Mayor Daley about looking forward and saying that these things are important enough to address. We have addressed them. We are prepared. The stockpile from the Center for Disease Control, they will be pushing out 25% of their stockpile. However, we had already have S&S stockpiles. In fact, the Illinois Department of Public Health received a rating of 96% for the Strategic National Stockpile. It was the highest in the country. That rating is reflective of the hard work and dedication of the people within my department and within the city of Chicago and throughout the state. There are 102 counties, 95 local health departments. We were on the phone with all 95 local health departments to bring them into the network, to make sure they were aware that we were sending out stockpiles to them. They are in the process now of receiving these stockpiles within the next 24 to 48 hours. The CDC has given us the landing order. We cannot disclose the location of those stockpiles, as that is for security reasons, so it's not for public distribution at this point in time. We also were in contact with all the hospitals outside of the Chicago area. Dr. Terry Mason, who is running the city, was doing a similar thing within the city confines. We also have Dr. Steve Martin, who has been working very hard with us on the county level. And I've also been in touch with Dr. Galloway, who is the Assistant Surgeon General for HHS. We also have a few things I want to mention, that we are having meetings with the faith-based organizations. We have over 500 faith-based organizations in our registry. We'll be doing an interdenominational meeting this afternoon. They have been trained in pandemic preparedness on how to deal with this specific issue. They have had 12 town hall meetings. They are very well prepared. Over 16,000 people have been trained. Also, we will be meeting with the Latino caucus as well, and with people who are involved with the Mexican consulate. This meeting will occur tomorrow. Multiple Latino organizations will be involved on how to deal with the issue of migrant populations. We have about 40 main groups that we deal with every year as they come in to take care of problems. So the governor has ordered us to really get involved with these groups to make sure that we are mitigating and taking care of those things that those people have as concerns. They are people, they are human. We take care of everyone, whether it's a child in a coal mine in southern Illinois or a senior in the city. It makes no difference to us, they're human. He has made that clear to us. Also, I want to mention very quickly that we do have some involvement with preparing materials. We have an excellent website you can go to, www.idph.il.us. We also have many things, ready.gov is a very good site for you to go, ready.illinois.gov. That site will actually have a lot of information for you. We are working with the SEOC, which is with Andrew Velasquez. He will be talking about that in more detail. We have stood up the FEOC, which is the Public Health Emergency Operations Center. That is operational, and we are working very, very closely with all of our partners who have met with all the other interagency things which are incredibly important for collaboration and for prevention. What they have put in place, our leadership, is an early intervention, which is extremely important at decreasing morbidity and mortality. The name of this game is Take Your Own Pulse. Relax. When we go into different situations, we have to take our own pulse and really look at things and make sure that we are dealing with a situation rationally. Now, if I told you that the seasonal flu killed 30,000 people in this country every year, that's the key to taking your regular flu shot. So far, we have no deaths. Right now, we have mild cases. No one has been hospitalized. It's important for the public to remain calm and to take the regular practices we normally do as the CDC filters through this. Of course, everything is very fluid, and as things develop, we'll find out more. But it's very important for you to understand exactly what we're dealing with. We're dealing with something that in 1918 we had no medications. We had no hospitals. So we have emergency service systems that were never there before. Take that into account, take the leadership into account, and we will do very well. Thank you. At this point, I would like to introduce,
Go ahead.
Yes. Great. He is my counterpart. He's part of my HIP now, so we are very closely connected. And it's my honor and privilege to introduce to you Director Andrew Velasquez. He is the director for the Illinois Emergency Management Agency that has been doing an incredible job coordinating all of us. Thank you.
Thank you, Dr. Arnold, Mayor Daley, Governor Pat Quinn, Ray Orozco, Commissioner. As Dr. Arnold mentioned, we have been working closely with one another, and in essence, one of the things that I always talk about that's rather important here is the fact that those of us in the emergency management community, as well as those of us in the health community and all of our public safety partners have to be attached at the hip as it relates to this particular threat. And so we have been working day and night monitoring this particular circumstance. Governor Quinn directed the activation of the state's Emergency Operations Center, and so we have been activated, working with all of our partners, all of the relevant state agencies that have a role with this strategic national stockpile, as Dr. Arnold mentioned, which is going to be critical to confronting this particular threat. And so all of the state agencies that have a relevant role have been working very diligently to review the SNS plan, to review obviously our pandemic influenza plans, and we have been coordinating with local emergency management agencies as well to ensure that they are taking a close look at their pandemic influenza plans, as well as working closely with their local health departments. And so again, these two elements that were mentioned today by both Mayor Daley as well as Governor Quinn, communication and coordination, that's key. We've been talking about the importance of preparedness, especially preparedness from an individual perspective, and so we've been asking individuals to do their part here. And so some of those websites that were mentioned, ready.illinois.gov, the CDC website, the IDPH website, Alert Chicago, all have critical preparedness tips that could be used. And while they may seem simple tips, like simple tips, but actually they're very effective. And so we strongly recommend that individuals take heed to those tips that are available on all of these websites. And so again, preparedness is key. We're asking individuals to do their part. Certainly, as you know, government cannot do it alone. And so all of these partners that we have in the community, like the faith-based partners and all of these other community-based organizations, we're asking for their assistance and for their participation. And as Governor Quinn talked about the proclamation, that's an important piece to this overall effort because it enables him to bring together all of the agencies, all of the assets and resources that the governor has at his disposal to ensure that we are effectively addressing and confronting this threat. And so again, it's critical and important that we take heed to the counsel that has been given to us by our federal partners, as well as our state partners, as well as our local partners regarding the types of preparedness tips that we can employ to ensure that we're adequately working toward the mitigation of this particular threat. And so thank you very much.
Now I'd like to have Dr. Terry Mason come up, Commissioner, Chicago Department of Public Health.
Thank you once again, and thank you, Ray, Mayor Daley, Governor Quinn, for this opportunity to work together in this very important public health issue. I'm Dr. Terry Mason, Commissioner of the Chicago Department of Public Health. And as anticipated, we are now seeing cases of swine flu both in the city and in the suburbs. And we expect these case numbers to rise in the next days, weeks, and possibly months ahead. And as those case numbers change from day to day, week to week, I want to strongly urge the press and the public not to focus on the numbers, but on simple, effective steps that all of us can take to reduce our risks, both of getting swine flu and passing it on to others. And at the risk of sounding like a broken record, I want to say that now, right now, it's time for all Chicagoans to think prevention, think preparedness. Specifically, I call on all Chicagoans, cover your cough, cover your sneeze, use facial tissues and discard them promptly, wash your hands regularly with soap and warm water, and teach these good habits to your children. If you are sick, stay at home and get better. Don't spread a cold or a flu at work, at school, at church, a store, a gathering, at the movies, or anywhere else. Protect yourself and protect others. If you have flu symptoms and have any questions or concerns, call your doctor. Classic flu symptoms can include fever, cough, sore throat, body aches, headaches, chills and fatigue, weakness, and sometimes, as Dr. Arnold mentioned, diarrhea and vomiting. Finally, boost your immune system. Your first system of defense is your immune system by eating fresh vegetables and fruit, drinking plenty of water, and most importantly, getting enough sleep. Yana Von Zahn said, if you wake up on Tuesday, you should go to bed on Tuesday. You don't wake up on Tuesday and go to bed on Wednesday. This advice is very simple, yet it is very effective and can save your life. In the Q&A portion of the press conference, the physicians here will answer all the medical questions you may have that we can, so I won't get into that at this moment. But I do want to say one thing before I conclude. I want to thank the members of the press. Your news coverage has been factual, fair, and focused. and the information you continue to share with your readers, listeners, viewers, both in your reports and on your websites, is user-friendly and prevention-oriented. You have clearly chosen help over hype, and I thank you for joining us in public health and in preparedness.
Thank you. Now I'd like to bring up Ron Huberman, CEO of Chicago Public Schools.
Good afternoon. I'd like to outline the steps that the Chicago Public School System has taken in conjunction with the Chicago Department of Public Health and our state partners relative to the last 72 hours and steps that have been taken. On Sunday, in coordination with Public Health, a letter went out to all 400,000 plus Chicago Public School kids. A letter was developed on Sunday that they took home on Monday, outlining both preventive steps and what could be anticipated if a case were to come up. This information also went up on the Chicago Public School website. On Sunday night, this past Sunday, we also notified all principals citywide, over 680 principals, about very specific protocols and policies associated with this particular virus, and particularly when they should make notifications based on changes in attendance or observations observed within their schools. We launched an internal hotline for reporting cases so that could be forwarded immediately on to Public Health and investigated. We also began a database that tracks all of our schools to monitor any aberrations in attendance. And we are currently in the process of reviewing all of the attendance for all of our schools, both for Monday and for Tuesday. As I said before, Monday morning letters went home with all students. We began to track attendance. Dr. Gerber from the Chicago Department of Public Health did a training for all of our area instructional officers to help then train principals both what to be on the lookout for and what the protocols we would be using in the event that we were to close a school. Last night at 9 p.m., received a call from Dr. Mason of a probable swine virus at a student at Kilmer Elementary School at 6800 North Greenview. That information, along with a 9% deviation in attendance for that school, resulted in the decision as a safeguard to close school this morning. At this point, we anticipate the school being closed at least today and tomorrow, and then based on the information that we determine in the next 2 days, in conjunction with public health officials, we'll be able to determine if it needs to stay closed longer from that point. At 6 o'clock this morning, we began to make automated phone calls to all of the parents at Kilmer School. We made another round of notification to all the parents at 6:30 this morning, notifying them that the school would be closed. All of our school buses that serviced that school were accompanied by CPS employees, so when the kids came to the bus, they were able to walk those kids back to their homes and provide parents with information relative to that. In conjunction to that, starting at 7 a.m. this morning, for all schools that are showing any kind of change in attendance, we have started calling those families and those parents with specific questions that have been put forth, and there's 10 questions that were created by the Department of Public Health to try to ascertain whether there's any other cycle of swine virus in any other school. We have both Spanish speakers and Polish speakers who are working the phone bank, making all of these calls to students who are out of school currently. That information, along with the database that shows aberrations in attendance, is what we will be using this to monitor this in the future and also to determine whether any other school closings will become necessary. Thank you.
Now, lastly, I'd like to bring up Michael Boland, First Deputy Commissioner, Department of Aviation.
At our airports, we continue to coordinate closely with the Center for Disease Control, the Transportation Security Administration, Customs and Border Protection, as well as the City Departments of Health and the Office of Emergency Management to better inform, prepare, and educate the traveling public at the airport. Some specifics that are happening at both airports: we have posted signs, as the mayor said, informing travelers at all of the checkpoints and in the departure areas. We are distributing the CDC Traveler Health Alert Notice handouts in multiple languages at all of the ticket counters with the airlines. The TSA has been providing a Traveler's Health Alert Notice to air carriers for distribution to passengers on inbound and outbound Mexico flights. We are hosting a daily press conference with all of the various, not press conference, I'm sorry, conference call with all of the airlines and the other federal regulatory and state stakeholders there at the airport. Additionally, we've put out new hand sanitizers, additional hand sanitizers at the checkpoints as well. And we continue to share information via our website and pass out and distribute the CDC's website information to all of the travelers, as well as their email and their hotline. That information is www.cdc.gov for the webpage. The hotline is 1-800-CDC-INFO, and the email, if you have a question, is cdcinfo@cdc.gov. Thank you.